The fall sports season is underway. We're here with Phillip Adler to talk a little bit about what we should be keeping in mind. So when it comes to sports injuries, what should we do to treat them?
You know, there's two different schools of thought. The first one is for what we call acute injuries or injuries that happen right now. Ideally, what we'd like to do is go with the RICEs, the rest, ice, compression, elevation. Now, I know there's some controversy with ice, but until some general guidelines come out and some more information comes out with research, we are still promoting ice. About 15 to 20 minutes on that affected area. Just be careful, watch for any blisters. We certainly don't want to have any quote-unquote ice burns. You can ice for too long, so let's try to keep it to about 15 to 20 minutes max. For those things that are lingering, that things may feel tight, we really only try to use heat after a little while has gone by, not before 48 hours. And certainly be conscious of swelling. If it's red and swelling, then we don't want to use heat because that's just going to make more blood come into the area. It could potentially make things worse.
So when in doubt, you might want to ice first.
When in doubt, I would definitely try ice first, yes.
Yeah.